I'm John Hickey. I'm the president of Sutliff Chevrolet in Harrisburg, Pennsylvania. Our Workplace Wellness Initiative is really more an information sharing effort than it is any specific one thing. We have a discount for the employee contribution portion of the healthcare insurance premiums. There's a discount for non-smokers. There's a discount for people whose BMI falls below a certain number, and there's a discount for people that agree to participate in the health risk assessment, which that latter category is by far the vast majority of our employees. We had healthcare professionals come into the workplace and do blood pressure screening and other, just basic health screens in addition to filling out the questionnaire. We had people agree that if a nurse practitioner or a healthcare professional would reach out to them, they would be willing to accept a call and talk about what things they might do to, again, mitigate risks that crop up based on their personal profile. There's 5 factors: your cholesterol level, your blood pressure, whether your waist is above 36 inches if you're a man. I mean, so they're not, they're just, it's a group of 5 different things, but those are the 3 that come to mind most readily.
Hickey says the company's also provided a program teaching healthy weight management.
We will pay for that program, but only if you complete it. So people pay, they pay for the whole program, and then we reimburse them 2/3 or more of the program back, because you want them to have some stake in the game. Those people, a lot of them have lost weight and kept it off. Seeing them lose weight has caused other people to use their own method of dieting or behavior modification. So we've had a number of people just in this building that have lost a significant amount of weight in the last year.
Hickey says discounts can vary depending on the part of the program an employee takes up.
If you and your spouse are both non-smokers and you're both within the BMI, that's $11 per pay, so $22 a month. And there's another $20 per pay if you agree to participate in the health risk assessment.
The Affordable Care Act will allow employers to increase such incentives starting next year.
It's got to be enough to get people's attention, but it's not enough that people who couldn't achieve those or didn't want to would feel disadvantaged. The popularity is, I think initially there was some hesitancy. Once people got into it, once they realized how non-threatening the interventions were, you get a phone call from someone who says, look, if you ought to set up an appointment with your primary care physician. You ought to see your primary care physician more often. It may be that you need to be medicated for your blood pressure, and the information they provide is people with the blood pressure at the range you have are X% more likely to suffer from coronary artery disease or have a heart attack. And they go, wow, I hadn't really thought about it that way, or if I lose 10 pounds, I get within this BMI number. So I think the people that have participated have been very appreciative of it. It is not about results, it's about awareness. Our entire program is built about making people more aware and then providing them incentives to improve.